In 2018, I was diagnosed with metastatic melanoma. This required surgical removal of a tumor in addition to 13 months of chemotherapy. While the chemotherapy was very successful in removing the cancer cells from my body, it did cause my thyroid to stop working altogether. In addition, it stopped my body from producing testosterone naturally. Therefore, ever since and for the foreseeable future, I will have to do an injection every 10 days of testosterone via IM injection or intramuscular injection. The skill of performing an IM or intramuscular injection is not very complicated. However, the main problem is we have to do we have some important steps we have to follow in order to avoid any kind of infection. So I'll be going over today the benefits or advantages of an IM injection. I'll talk about the supplies needed in order to perform this skill. In addition, I'm going to demonstrate for you how to do an IM injection by doing my injection on myself today. So first, I wanted to talk about the benefits of an IM injection or advantages of an IM injection. And I went to the NIH's website. This is the National Institute for Health's website. They laid out a few really good rules, a few really good advantages for this. Number one, the medication is directly injected into your bulky muscles, and it goes into your bloodstream a lot quicker. That means you can take less medication because it doesn't have to break down in the liver. Additionally, the bulky muscles are very vascular. Therefore, they have excellent absorption and distribution throughout your body. You can be easily completed at home by any person that's under a physician's directions. And also, it's fast and nearly painless. And it's got a little pinch to it, but it's not that big of a deal. Next, I want to talk about the supplies you're going to need in order to do this procedure. So number one, first and foremost, we're going to need hand sanitizer, or you can use soap and water. You want to make sure that you have a clean environment, clean hands whenever you're doing this, because you want to keep it as aseptic as possible. Next, you're going to need the actual medication, okay? You're going to need a brand new needle and syringe. However, for time purposes, I've already drawn this up, but you'll need a brand new needle and syringe. You're going to need a 2x2 gauze, and this is for after the procedure so that you can cover up and catch any blood that may leak out. You need a alcohol prep pad. For this case, I'm actually going to use a 4x4 gauze and some rubbing alcohol. You're going to need a bandage or a Band-Aid, any brand will work. And lastly, you're going to need a sharps container. Anytime you're using needles, you have to make sure they go in an appropriate container. Can't just throw those in the garbage, okay? All the information as far as the supply list, I went to Veritas Pharmacy. They laid out everything that was going to be required for any kind of injection. So now moving on, drugs.com had a wonderful layout as far as step-by-step procedure, or step-by-step on completing this procedure. So I used their website. It was wonderful. I've left a link below for you. First, the first thing you're going to want to do is pick an injection site. They had a great image on their website. When we're talking about IM injections, you only have about 5 places that you can go. So you have a deltoid muscle, which is going to be on your shoulder. You've got your thigh. There's four muscles in your thigh. That's why we call it your quad. You're going to use the 2 outer ones if that's necessary. You have your gluteus medius, which is on the outer side of your your buttocks, and then your gluteus maximus, which is going to be your actual butt cheek, okay? Today we're going to do the deltoid just because we're on camera. So the first thing we're going to do now that we've picked a location is we're going to use our hand sanitizer. We're going to clean our hands. Moving forward, we're going to grab our medication. And the main thing we need to do with our medication is we got to go over the 5 R's. First one is right person. So you got right person, right dose, right medication, right date, and right color. So right person, yes, it's my medication. Right dose, it's gonna be 200 milligrams in the entire vial, and we're only gonna take half the vial today. We're gonna talk about the right color. Yep, it's a clear colored medication. It has a little bit of a yellow tint to it, that's correct. And we're gonna look at the date on it, and it is 10 of 2025. That is correct. We're within our normal date range, so it is not out of date. Okay, the next step would normally be taking and drawing the medication up. However, for time purposes, like I said before, I've already taken care of that. All right, so now we're gonna go ahead and make our alcohol prep pad. What I'm gonna do is open my 4x4 gauze, and I'm gonna fold it in half. I'm gonna use my rubbing alcohol. And I'm just gonna get it nice and doused with alcohol, because I need to make sure that I rub that area and clean it very well. Put that right back on the package that I just took it out of. And I'm gonna take my 2x2 gauze that we're gonna use afterwards. Same thing, I'm gonna put it on top. I wanna make sure I've got everything accessible. So now we're gonna pick our site. So I'll roll my sleeve up here. Okay, so the muscle itself is a triangular shaped muscle. It's wider at the top and it comes down narrow. So anywhere in this general location, when you squeeze, you can see that muscle move. Anywhere in this general location is gonna be fine. So what we're gonna do is we're gonna clean it off really well. And you generally wanna use a motion. It's like a circular motion moving outwards. Okay, so you're moving any kind of dirt outwards away from the injection site. So now I've got my needle, I've got my syringe. I've already actually pushed any air pockets out of this as well. You don't want to inject any air into your muscle. So when it comes down to it, right there just below where my shirt is, I'm gonna inject 1, 2, 3. Before we push any medicine in, we want to pull back on the plunger. And what we're trying to do is make sure that there's no blood return. If there was blood return, that would mean that we're in a blood vessel, and that's not good. You want to go into the muscle. So now I'm going to slowly push the medication in. And again, this is a thicker medication. It sits in an oil, so it is very hard to push in. You're not going to go very fast with this one. And you want to try and, I know it's hard to say, but you want to relax your muscle while you're doing this. Okay, once it goes all the way in, the black bumper will stop. Okay, I'm gonna pull it directly out and straight into the sharps container. I'm gonna take my 2x2 gauze, I'm gonna cover it, and I wanna massage that area just a little bit. I'll leave that on there while I get my Band-Aid ready. Okay. Okay. Only had a little bit of blood there, which is good. That's all we want. Cover that with the Band-Aid, put my shirt down. Now I understand that not everyone in their lifetime is gonna need to use an IM injection for whatever. This can be done for hormone therapy, it can be done for diabetes. There's a number of things that you can use it for. I understand that not everyone's gonna need it. However, I hope with this presentation, I've been able to show you enough information that will essentially make you feel more comfortable in the event that you had to do it for yourself or you had to help a family member. We have gone over the advantages of it. We've talked about the supplies you're gonna need, and I've actually demonstrated you how easy this task is. I hope I've given you all the material and the wisdom to move forward in the event that you need to do it for yourself. I hope I've made you feel more comfortable and more understanding of this procedure. And I thank you for watching my video, and I hope you have a wonderful day. Thank you.